Welcome back to the deep dive. Today, we're tackling a really persistent challenge in public health. How do we move beyond just, diagnosing community problems to actually building lasting well-being?
Mm.
We're diving into a methodology that kind of flips that script entirely. It draws from research by Blanco Botello and colleagues on health assets mapping in Asturias, Spain.
Yeah, it's an incredibly potent shift in perspective, really.
Hmm.
Instead of focusing only on what's broken or what's missing, this research helps us discover the inherent strengths within a community.
Okay.
So our mission today is basically to unpack this powerful approach, what it is, how it works, and, well, why it's sparking so many illuminating insights in community health.
I'm genuinely curious about this because, most of us are conditioned to identify problems first, aren't we?
Absolutely.
When we look at community health, our usual understanding often starts with a list of deficiencies, like what are the disease rates, what are the social challenges, what's not working.
That's absolutely right. We typically operate from what's known as the deficit model. Now, this approach, it provides crucial data, definitely, but it primarily focuses on identifying those negative indicators of health and the social determinants that contribute to them.
Right.
So, for example, the Health Observatory in Asturias, OBSA, they initially gathered tons of quantitative data, basically, a health snapshot, that highlighted all these deficits. It's vital information, sure, but like you said, it's only part of the story. It shows you the empty spaces, maybe, but not the vibrant, full ones.
And this is where the approach really distinguishes itself then. The paper talks about complementing that deficit model with something called a salutogenic approach and an assets model. That sounds like a huge shift in worldview. How do those two concepts fundamentally alter how we think about health? How do they work together?
Well, that's the core paradigm shift, and it's profoundly fascinating when you dig into it. The salutogenic model, which was proposed by Aaron Antonovsky, it doesn't ask the usual question, what causes disease?
Mhm.
Instead, it asks what creates health.
Ah, okay. Different question entirely.
Exactly. It's about understanding the factors that actively promote well-being and resilience. Then, when you couple that with the health assets model, championed by researchers like Morgan and Ziglio, it encourages us to actively identify the inherent strengths and resources already present.
Right.
So it's moving from this laser focus on problems to recognizing and actually building upon the existing potential and resilience. For you, the listener, this means thinking about health not just as, the absence of illness, but as the active presence of vital resources, connections, and inherent capacities.
Okay, so if the deficit model highlights the cracks in the pavement, maybe.
Oh, yeah.
The assets model helps us find the bedrock underneath and the materials we already have to build with.
That's a great way to put it.
But what are these health assets specifically? When we talk about these riches, are we just looking for the obvious stuff, hospitals and doctors, or is it something far more nuanced, maybe stuff we overlook? Oh, it's so much more. And this is where the treasure hunt really begins. The methodology broadens our definition of resources considerably. McKnight, who's a key figure in asset-based community development, or ABCD,
Mhm.
he identifies assets as pretty much anything that can be used to improve the quality of life within a community. And this includes not just the formal institutional resources, but also informal networks, personal talents, even symbolic elements that contribute to well-being.
Okay, give us some tangible examples from the study then. What kind of assets did they actually find that might surprise someone who's used to a purely clinical view of health?
Absolutely. The study's framework categorizes these, and, well, some of the most surprising and powerful are often the less visible ones. For instance, consider individual resources. This isn't just about doctors' qualifications. It's the incredible power, passion, unique talents people have, practical skills, experience, knowledge, valuable time, even just the simple care that community members, families, neighbors possess. Right. Like someone who's good at fixing things, or someone who organizes the street party.
Exactly. Imagine a retired carpenter, eager to teach woodworking to local youth maybe, or a neighbor who consistently checks in on elderly residents. These are often invisible but incredibly potent forces for health.
Yeah, I can totally see how those informal connections could be maybe even more impactful sometimes than a formal program.
Mm.
What else did they uncover that kind of expands our understanding of what a health asset is?
Well, another crucial category is informal association resources. These are often the real hidden gems, those natural care networks or groups that just spontaneously form for mutual support.
Like a book club. Or
No, could be. Or maybe a walking group that shares health tips, or parents who informally carpool for after-school activities. They offer a shared vision sometimes, invaluable networks, local knowledge, shared spaces for connection. often without any formal structures or funding.
That's a key distinction, isn't it? So these aren't just things, but living, breathing connections and capacities within a community. It does make me wonder, though, about the challenges. It sounds incredibly positive, this whole approach, but I can imagine some skepticism. Do communities sometimes resist this shift? Maybe see it as, I don't know, downplaying the real issues they face.
That's a great point and a very real challenge the study implicitly addresses. Often the biggest hurdle is just that initial mindset shift, convincing people to truly look for strengths when they're so used to focusing on problems.
Right.
And also ensuring they understand that acknowledging assets doesn't mean ignoring deficits. It's not either. Plus, making sure the mapping process stays genuinely community-led.
Yeah.
And doesn't just become some top-down bureaucratic exercise that's crucial for its success and, well, sustainability.
Yeah, that makes sense. It sounds like the process itself needs to be as human and engaging as the assets it's trying to uncover. So, okay, once we understand what we're looking for, these incredible, often hidden assets, how does the community actually go about finding them and, crucially, connecting them? The paper details a fascinating hands-on process, doesn't it?
It truly does. It's a structured but highly participatory journey. It starts by sort of setting the stage for this new way of thinking and moves all the way to making these discovered assets visible and, most importantly, actionable within the community.
So how does it kick off?
Well, it starts with a conversation, really. The first crucial step is what they call presentation to local agents. This is where the team introduces the whole strategy to key reference people in the community, leaders in the city council, local associations, that sort of thing.
Okay.
They are given the existing health indicators, the deficit data we talked about, but they are also immediately asked these critical, reflective questions, like, what's good about the place where you live? And what can you do to improve life in your community? It's about planting that seed of possibility right away, framing the conversation in terms of inherent strengths from the get-go.
That's a clever way to immediately reframe the discussion, isn't it? Instead of just presenting a list of problems, you're engaging them in solutions from day one.
Exactly.
So what happens after that initial spark to really get to the heart of the community and, involve more people in this discovery?
Right. So next we move into work with field agents and key informants.
Yeah.
These field agents are identified as the true key people within the community who will actually lead the mapping process. They form what the study calls a motor group, essentially. A small, dedicated core team of community leaders, enthusiastic individuals.
Drivers, basically.
Yeah, the drivers. And this group then leverages their deep local knowledge to identify key informants. Now, these are individuals who really know the community deeply, understand specific assets, or maybe represent minority groups whose voices might otherwise be missed.
Yeah.
Their insights are absolutely essential to pinpoint where assets are located and understand their unique nature.
Okay, so this motor group becomes the engine driving the whole exploration. This is where it gets into the real field work, right? Getting hands-on with discovery, engaging with the community on a deeper level. What techniques do they actually use to uncover these hidden gems? I imagine it's much more than just a dry questionnaire.
Oh, you're absolutely right. It's a very hands-on and conversational. This is field work in the community. And it employs a whole variety of engaging qualitative techniques. It's definitely not about ticking boxes on surveys. It's about genuine conversation and shared experience.
Like what? What kind of methods?
Well, some of the most compelling methods they used include in-depth interviews.
Standard enough, yeah.
Yeah, face-to-face conversations designed to truly understand people's perspectives, their behaviors, feelings, experiences related to health, and their community. It's about listening deeply to individual stories. Then there's photo voice.
Photo voice. How does that work?
It involves inviting people to take photographs of their community, things that represent health or challenges to them, and then using those images to spark reflection and discussion. It's a really powerful visual storytelling tool. It lets people share impressions and insights that maybe words alone wouldn't capture.
I can see that. Pictures sparking different kinds of conversations.
Exactly.
Well,
and then there's narrative research or storytelling. This technique actively encourages people to share personal stories about how they've maybe faced difficult situations. And this process often reveals incredible resilience, ingenuity, and those informal support systems we talked about. And one of my favorites, actually, is café tertulias, or coffee gatherings.
Okay, that sounds interesting.
It's a really unique approach. You get maybe 5 or 6 people gathering around a table in a cafe, just chatting freely about a topic of common interest. Then, after maybe 20 minutes, they switch tables. And a host at each table summarizes the previous discussion to the newcomers.
Ah, like a World Cafe kind of idea.
Sort of, yeah. It fosters this really dynamic, organic conversation that generates incredibly rich insights and allows ideas to cross-pollinate in a very natural, informal way.
Wow, those methods sound incredibly human and engaging. Far from a dry data collection process, it sounds like it's about building relationships and trust, too, which I imagine is essential for truly uncovering genuine assets.
Definitely. Trust is key.
So once all these diverse assets are identified and this rich information is gathered, how do they make sure this knowledge isn't just lost or, stuck in a report somewhere? How do they make it accessible and useful for the whole community?
Right, that leads us directly to the final crucial phases: visibility on Web 2.0 and transfer to local agents and population. So the discovered assets are first made visible online. They use, for example, a platform like the Asturias Actua website. This is where they leverage what they call Web 2.0 tools, interactive user-generated content platforms. It allows assets to be organized by specific tags like sexual health or youth resources, making them easily searchable.
Ah, so people can find what they need.
Exactly. Accessible to anyone with internet access.
Right.
But, and this is important, because web tools aren't universally used, especially by all segments of the population.
Good point. Digital divide.
Precisely. So the final phase ensures broader dissemination through more traditional methods, too. Things like community forums, public meetings, even municipal print publications. The ultimate goal is to sort of revitalize the community's overall health snapshot, integrating both the identified deficits and the newly mapped assets to genuinely empower people to initiate real positive change from within.
This deep dive has really shown us a powerful shift in perspective, hasn't it? Moving from that focus on problems to a focus on potential. It just makes me think about how often we overlook the everyday assets right in front of us. The quiet strengths that are so easily taken for granted. Let's try and make this really tangible. Imagine, say, a struggling community youth program. Traditionally, we'd probably look at its funding gaps or lack of facilities first, right?
Standard approach.
How would this asset-based thinking completely flip the script on trying to revitalize it?
Okay, yeah, that's a fantastic example. With asset-based thinking, you start by asking completely different questions. You'd ask, what are the existing passions and talents of the young people themselves? What are they already interested in?
Right. Start with them.
Exactly. Then, who are the local elders with wisdom or skills to share? Maybe a retired teacher, a musician, a craftsman. Which local businesses might offer mentorship, or maybe even just space for activities? Is there a park nearby that could be activated for informal sports or art projects?
Okay, so you're looking inward first.
Yes. The program would then build from these existing energies, from these often untapped assets, rather than just trying to import expensive top-down solutions. And the study implies this creates not just a revitalized program, but potentially a more self-sustaining ecosystem of support, because it's built on what the community already has and actually values.
So this methodology really underscores that health isn't just about fixing problems. It's fundamentally about recognizing and nurturing the strengths that already exist. It's about empowering individuals and communities to identify their own health heritage, their unique collection of assets, and then actively build on it. What do you think is the biggest misconception people have about this approach?
I think the biggest misconception is probably that focusing on assets means ignoring the problems, that it's somehow putting on rose-tinted glasses.
Yeah, I could see people thinking that.
But it's actually quite the opposite. By understanding and mobilizing existing strengths, communities are often better equipped to tackle those very challenges, but from a position of power and capability, not just need. This approach really highlights the immense value of social participation, of action research, creating a framework where people aren't just passive beneficiaries of health initiatives, but active agents in shaping their own health outcomes. It's truly about self-determination in health.
That's a crucial distinction. It really allows communities to own their solutions, doesn't it?
It does.
So here's a thought then for you listening to carry forward. How might applying this kind of asset-based thinking transform the way you approach a challenge? Maybe in your own life, your family, or even just your neighborhood. What hidden strengths, what overlooked assets are waiting to be mapped and celebrated right where you are? And that's our deep dive for today. We really hope you're leaving with a fresh perspective on what truly makes a community or maybe an individual healthy and resilient.
Yeah, remember, the most valuable knowledge is often that which helps us see the world and ourselves in a completely new light. This methodology is a great reminder that we often have far more resources than we realize, just waiting to be discovered and connected.
Thank you so much for joining us on this exploration. Keep looking for those assets, and we'll catch you next time on The Deep Dive.